Good afternoon. This is our lecture on emerging diseases, a very timely topic for public health. Coverage of the lecture would be the following: infectious diseases and the trends, the definition of emerging and re-emerging diseases, factors that contribute to emergence, examples, and public health responses. An emerging disease is one that has appeared in a population for the first time or that may have existed previously but is rapidly increasing in incidence or geographic range. A very good example is the novel coronavirus, which we are experiencing now, which originated in a marketplace in Wuhan and eventually spread into other countries around the world. Infectious agents that have been known for some time that had previously fallen to such low levels that they were no longer considered public health problems but eventually showed upward trends in incidence or prevalence would be considered re-emerging disease. Examples would be the re-emergence of measles, polio cases in the Philippines, previously eradicated but recently showed cases. The WHO has listed cases or emerging diseases included in its watch, namely the following: Crimean Congo hemorrhagic fever, Ebola, Marburg hemorrhagic fever, Lassa fever, your MERS-CoV, SARS, conifavirus disease, Rift Valley fever, chikungunya, severe fever with thrombocytopenia syndrome, Zika fever, and the most recent would be coronavirus. Would this following be considered emerging and re-emerging diseases? HIV, tuberculosis, malaria, avian influenza, and dengue? These are not included because interventions are already in place such that it could be controlled. The trends: since last quarter of the 20th century, new and resurgent infectious diseases have emerged, and its unusually large number of viruses such as the rotavirus, cryptosporidiosis, HIV, hantavirus, which has emerged a case in China recently, Lyme disease, legionellosis. And the infectious disease paradigms are constantly changing. Before, it used to be guinea worm, smallpox, yaws, poliomyelitis, measles, leprosy, neonatal tetanus, which has been eradicated thanks to the help of vaccination efforts. Increasingly, still infectious would be the following: AIDS, avian influenza, Ebola, Marburg, cholera, etc., to change the landscape of infectious diseases. What are the factors that contributed to this change? Again, we go back to the epidemiological triangle that we have studied in our family medicine module. Agents of disease undergo evolution of pathogenic infectious agents. Our microbes adapt and change according to their environment. Development of resistance to drugs due to this adaptability, and resistance of the vectors that these agents use to infect the host to pesticides. Changes could also occur in the host wherein the disease would reside in. Human demographic changes has helped in emergence of disease, human behavior such as sexual and drug use practices, increased emergence of disease, immunosuppression, especially with the emergence of HIV, AIDS, and other chronic diseases makes one more susceptible to disease. Poverty and social inequality also is a contributing factor. And environment, climate, and changing ecosystems continue to contribute to emergence. Economic development and land use, urbanization and deforestation, and technology and industry also contributes to emergence. International travel and commerce, breakdown of public health measures, and deterioration in surveillance systems, they all contribute to emergence and reemergence of certain diseases. And more than two-thirds of emerging infections originate from animals, be it wild and domestic. Coronavirus comes from bats. Emerging influenza infections associated with geese, chicken, pig. Animal displacement in search of food after deforestation, such as in the case of Lassa fever. And humans themselves penetrate, modify unpopulated regions, and come close to the animal reservoirs, such as the yellow fever. And deforestation forces animals into closer human contact, increasing the possibility for agents to breach species barrier between animals and humans. For example, the El Niño would trigger natural disasters and related outbreaks of infectious disease such as malaria and cholera. And global warming is responsible for the spread of malaria, dengue, leishmaniasis, and filariasis. Poor populations are also a major reservoir and source of continued transmission. Poverty, which brings about malnutrition, also is part of a severe vicious infectious disease cycle. And public health lack of funding, poor prioritization of health funds, misplaced in curative rather than preventive measures, fails to develop adequate health development systems, also contribute to an emerging disease. Urbanization and population displacement also play a role in emerging disease. So growth of densely populated cities, which would result in substandard housing, unsafe water, poor sanitation, overcrowding, air pollution, which result in more than 10% preventable ill health that we could have prevented otherwise. There are problems of refugees and displaced persons. Of course, there's common diarrhea and parasitic disease and Lyme disease, resulting from changes of ecology, increasing deer populations and migration of population. For the host, human behavior would be a factor, unsafe sexual practices, which would propagate HIV, gonorrhea, syphilis, changes in agricultural and food production patterns, particularly would bring about E. coli. There would be increased international travel, spreading influenza, and the increased outdoor activity. Antimicrobial drug resistance is also a factor. Wrong prescribing practices, non-adherence by patients, and counterfeit drugs, use of anti-infective drugs in animals and plants, bring about emergence of disease by making the bacteria and virus resistant to the antibiotics that we are using, rendering them ineffective to treat disease. So it will lose effectiveness. There would become community-acquired illnesses, And your antiviral, HIV, antiprotozoal, and antifungal would then be rendered useless. Consequences: we would have prolonged hospital admissions, higher death rates from infections, and it would require more expensive and more toxic drugs, and eventually would lead to higher healthcare costs. So again, with the epidemiological triad, we have our animals, our vectors, our environment eventually affecting the host, and disease, emergence and reemergence of disease would be an interplay of these factors. Examples of recent and emerging diseases. So coronavirus initially started in China and currently is now affecting the whole global population, 137 countries, especially Italy, Spain, and the US. And they are also fighting other emerging and re-emerging diseases of their own. Examples of which are hepatitis C, first identified in 1989. Estimated global prevalence is at 3%, and hepatitis B, although identified several decades earlier, presents an upward trend in all countries with a prevalence of more than 90% in high-risk populations. Zoonosis: 1,415 microbes are infectious for humans. Of these, 868 are considered zoonotic, and 70% of newly recognized pathogens are zoonosis or come from animals. Coming from an animal interface would be the following: your coronavirus, of course, from bats, avian influenza, Ebola virus, Marburg's virus, and the like. SARS was first recognized at the end of February 2003 in Hanoi, Vietnam. A middle-aged man who has traveled extensively in Southeast Asia before becoming unwell was admitted to hospital in Hanoi on the 26th February. With high fever, dry cough, myalgia, and mild sore throat. Over the following 4 days, he developed symptoms of adult respiratory distress syndrome requiring ventilatory support and severe thrombocytopenia. Despite intensive therapy, he died on March 13 after being transferred to an isolation facility in Hong Kong. On the basis of data from the SARS in Hanoi and Hong Kong, the incubation period has been estimated to be 2.7 days, but usually 3.5 days. Attack rates of more than 56% among healthcare workers caring for patients with SARS is consistent in both the Hong Kong and Hanoi foci. No infectious diseases has spread so fast and far as SARS did in 2003, but coronavirus has spread more rapidly and more virulent than SARS was in 2003. Lessons learned. Have we learned from the lessons that we have had from the previous pandemic? So an infectious disease in one country is a threat to all. One problem that we have known that as early as January, China was in a lockdown trying to contain the virus, and some countries have failed to protect their borders, have failed to take the coronavirus as a serious threat, thinking that it was just simple influenza. We should remember that any infectious disease, especially unknown, is a threat to all. Important is the air travel in international spread. Hence, it was important to close borders to limit transmission. and tremendous negative economic impact on trade, travel, and tourism would estimate losses from 30 to $150 billion. We're slowly experiencing that effect of global recession, with tourism being drastically affected. The stock market is crashing. Aside from health and manpower, health infrastructure breakdown. So for containment, high level of commitment is crucial for rapid containment of a pandemic outbreak. WHO plays a critical role in catalyzing international cooperation and global partnerships, and rapid sharing of data information enhances preparedness and response. Another example which would be the H5N1 or highly pathogenic avian influenza. Avian influenza is an infectious disease of birds caused by type A strains of the influenza virus. The infection can cause a wide spectrum of symptoms in birds, ranging from mild illness which may pass unnoticed to a rapidly fatal disease that can cause severe epidemics. Avian influenza virus do not normally infect humans. However, there have been instances of certain highly pathogenic strains causing severe respiratory disease in humans in most cases. The people infected had been in close contact with infected poultry or with objects contaminated by their feces. Nevertheless, there is concern that the virus could mutate to become more easily transmissible between humans, raising the possibility of an influenza pandemic, such as what happened to coronavirus. Novel swine origin influenza A or the H1N1 is also a respiratory disease that comes with pigs, high level of illness but low death rates. Pigs can get infected by human, avian, and swine influenza virus. Swine flu influenza. So initially, 2009, outbreak was reported in Mexico. Then April 15, it is identified. April 25, WHO declares public health emergency. And by April 27, there's a pandemic alert raised to phase 4 and eventually phase 5. By May 5, more than 1,000 cases are confirmed in 21 countries. Screening at airports for flu-like symptoms are done. Schools were closed in many states. And May 16, India reports first confirmed case. So stockpiling of antiviral drugs and preparations to make a vaccine were done. So you could see the parallelism between what is emerging now in the coronavirus and what is happening in real time. So this is the map of your H1N1. Worldwide, the H1N1 affected 162,000 people and had 1,154 deaths. India had 555 cases and 1 death. And you will see this disparity between the current pandemic compared to this previous pandemic. Other examples of re-emerging infectious diseases would be diphtheria. In India, this plague re-emerged in August 1994 when it was detected in the Bid district of Maharashtra. This was followed by pneumonic plague in Surat in Gujarat, resulting in over 50 deaths and introduced and induced a mass exodus of people. Eventually, plague was reported from 12 Indian states. This would be the emergence of dengue, hemorrhagic fever. Bioterrorism, possible deliberate release of infectious agents by dissident individuals or terrorist groups. And these are attractive instruments of terror, easy to produce, mass casualties, it's difficult to detect, and widespread panic and could cause civil disruption. There's also a theory that coronavirus may be part of bioterrorism, but was dispelled by WHO. Highest potential of bioterrorism would be your Bacillus anthracis, botulinum toxin, tularensis, pestis, variola virus, viral hemorrhagic fever, viruses, and likeliest route would be aerosol dissemination. What are our tasks in dealing with emerging diseases? Surveillance is very important at the national, regional, and global level. Epidemiology is at the forefront. Laboratory for detection. Ecological and anthropological data is also needed. We have to have investigation and early control so that we could implement preventive measures, behavioral, political, and environmental, so that we could monitor and evaluate cases. Changes in behavior could include as extreme as community quarantine, such as what we are experiencing now. National surveillance of our current situation would be important so that we could have independent vertical control programs, surveillance gaps for important diseases, which would augment our limited capacity in the field epidemiology, lab diagnostic testings, rapid field investigations, and inappropriate case definitions. Delays in reporting, poor analysis of data and information at all levels would be critical in pandemics. No feedback to the periphery, insufficient preparedness to control the epidemic, and no evaluation would all be factors in emerging diseases. Solutions. Public health surveillance is very much important in how we respond to emerging diseases. Rapid detection of unusual and unexpected, unexplained disease, and not concealing it, such as what happened to coronavirus, is important. Track and exchange information in real time, which is very much aided by internet technology. Response efforts that can quickly become global so that we could contain transmission swiftly and decisively. The Global Outbreak Alert and Response Network, this is coordinated by the WHO, is a technical collaboration of existing institutional networks who pool human and technical resources for the rapid identification, confirmation, and response to outbreaks of international importance. The network provides an operational framework to link this expertise and skill to keep the international community constantly alert to the threat of outbreaks and ready to respond. So this would be an outbreak verification list sharing data with public health professionals, correspondences. So internet-based information technologies improve disease reporting, facilitate emergency communications and dissemination of information. However, with the internet, you should also know how to discern when your news is credible or not, because fake news abound. So when you see in the internet, make sure to verify. Human Genome Project, the role very much of researches in human genetics and disease susceptibility could not be emphasized, so that our response would be decisive to affecting progression and host responses. Microbial genetics, methods for disease detections, control and prevention, improving techniques and development of vaccines, geographic imaging systems to monitor environmental changes that may influence disease. So key tasks, it's a synergy between national, local, and regional growth and skills needed. We have to have our infectious diseases specialists, public health specialists, telecom and informatics, information management, laboratory, epidemiologists, and international field experience so that we could fight emerging diseases. So this is a collection, distribution, and verification so that we could respond adequately. Our best defense is a multifactorial one, coordinated, well-prepared, and well-equipped Philippine system, partnerships, our clinicians, our laboratories, and Philippine agencies, so that we could deliver improved methods for detection and surveillance. Effective preventive and therapeutic technologies, so that we could have a strengthened response capacity, a strong political commitment, and adequate resources to address underlying socioeconomic factors and networking. And it's a trend. Infectious diseases keep emerging and re-emerging. It is therefore imperative that while efforts for control of well-established communicable disease must continue relentlessly, a regular vigil must be maintained on the behavior of emerging and re-emerging disease, such as what happened to coronavirus. Epidemiologists and infectious disease specialists have been warning since 2003 of an eventual pandemic waiting to occur. And now we are in the middle of it. So stay home, stay safe, wash your hands. Thank you. Please subscribe to my channel for further preventive medicine and community health lectures. Thank you.